All right, I think we are live.
Awesome. Everybody, thank you for your patience. I'm solo parenting my four for a little while, and so everybody needed everything right before I was supposed to jump on this call. So I literally said, "Okay, guys, I'm gonna go on this call. I need you to not, you're just gonna have to entertain." And I walk out the door. My 4-year-old says, "Mama, could you help me with?" I'm like, "No, no, I cannot."
Always how it goes.
Still going really well over here. So today we're going to talk a little bit about breastfeeding and if you can wean with breastfeeding, if you can tube feed with breastfeed, or if you can breastfeed with tube feeding. So for a lot of families, it feels like that's kind of off the table. So we wanted to kind of talk a little bit about both what we see and also just what is often possible, whether your child is tube fed or whether you're in the weaning process, all of those things. And as always, if you have questions, I will be monitoring. So please message us, comment as we're going. That way we can definitely try and answer your questions as we're right here today. But otherwise, you can always leave questions in the comments as well. Um, so to start, I'm Aubrey. I'm one of the registered dietitians at GIE and am also a lactation counselor here at GIE. And I also had a child who weaned 6 years ago now with GIE and was on breast milk for 15 months of her life.
Nice. I can't believe it's been 6 years.
I know.
And I'm Amanda. I am one of the feeding specialists here at GIE.
So I think one of the first things, so obviously I have both pumped personally and then have nursed my other children and am a lactation counselor. And so I know one of the things that I talk a lot about with families is that if they want to keep supplying breast milk, that we can usually make that possible, right? And sometimes it's not through nursing, but sometimes it is.
Yeah.
Um, do you I mean, what do you see as a feeding therapist? Are there things you look for to determine whether it would be best to try and go back to the breast versus trying to move to a bottle versus trying to move? What do you look for?
Well, I always try to first take into consideration what the family would like to do. If there is a desire to breastfeed, I always want to try to be able to work toward that goal. But there are times where breastfeeding is not the best option, either if there's supply issues or if the child isn't safe, we really need some other interventions like a slower flow or thickening or anything like that when we're looking for oral feeding. So we do try what we can at the breast, but that's not always where we can go, especially when those skills aren't established yet already. And we even find that with kiddos that are always orally fed, have never had a tube. Sometimes breastfeeding is just really hard to achieve safe feeding. But I do always try to consider that when, if the family really has a desire to go back to the breast, can we do that and have that on our table? And even if that's a goal that we're working for, even if we don't start there.
Yeah, and I always look at too the age of the child. Older kiddos, and by that I mean like after 6 to 8 months is like the ooh, we're getting close range. Anything before 6 months, and I think there's like often a very good shot that if we want to nurse, we can. For those kiddos, after we're like 6 to 8 months and beyond, we have had success if those children have had a history of breastfeeding at some point prior to the tube or during the tube. But trying to get them back to the breast at that age, it's not impossible. It's just much more challenging because their instincts are less and they tend to be teething. And so there's a lot more chomping at the breast, and that's harder to kind of like stop because they don't know what they're doing. And again, it doesn't mean that it can't be done. It just means that a lot more, oftentimes we need to do like, we need to talk about doing like a nipple shield just to make sure mom is not getting beat up when she's trying to supply. And we have to kind of talk about doing like a supplemental nursing system so that they're getting more milk right away, that like immediate feedback. Because I think that's one of the hard things about nursing is that with a bottle or with a straw cup or whatever, the moment they start sucking, something's coming out. So there's like an
Yeah.
immediate feedback of like, oh, I see what I'm doing. Whereas at the breast, to really get that letdown, they have to willingly suckle for a good amount of time. And sometimes they're like, what am I doing? Am I chewing on this? Am I like, what am I supposed to do? So I
Yeah.
think that can make it really complicated as they get older, especially because that drive to snuggle and like to nurse for soothing is just not there as they get older and older. But those really young ones, I think we have a much better shot at getting them back to breast successfully.
Yes. And on that kind of same thought is when we are starting to establish those nippling skills, we usually see a progression through that weaning process of first we're just kind of playing with it and tolerating that coming to our mouth and being okay and making friends. And then we're doing some playing, chomping, moving it around, but we're not actually latching for quite a while. And then we start, but with that play, when you munch on nipples, you get little drops and that starts to reinforce. And then as they get more into it, they start that suckling. Um, so because a lot of that, I like to a lot of times try both when we're weaning so that we can still have that closeness and even kind of help stimulate some of that milk production, even if we're not getting a full latch. And then practicing with the bottle and then moving to that, how we're going to supplement with the tube. And just kind of on that thought process too, a lot of times people always kind of look for like what bottle is the closest to the breast, and really none of them are. It's a very popular marketing tactic that like this one's closest to the breast. None of them are. It is physically impossible to make a bottle like the breast because the breast works within a vacuum and you get that letdown and that you have to suck, let down those things like that. But we can also look at some different factors with bottles to make them more successful, even if it's not like the breast. And so that's
Yeah.
something you can really lean into your team where we can troubleshoot what we're seeing and what we can do to help that latch achieve on a bottle as well.
Yeah, and building off of that from the lactation side, and I'm sure from the speech therapist side as well, that we see that a lot of times the ones that are marketed towards breastfed babies are these actually really short nipples, which
Mm-hmm.
is not at all what happens when a baby nurses. So it actually trains the tongue to only use that beginning part, as opposed to what actually needs to happen when they nurse, where they draw the nipple way back into the soft palate. And so you're actually better off with those longer nipples where the baby is going to have to draw more back and pull more back into the mouth. Oh, sorry. So, sorry. My Zoom won't let me change my settings.
Oh, they did finally add a setting. I'll tell you how to do it later that you can turn it off.
It's funny because my really young kid patients really love it. So it's a really good like getting them to calm and focus. But sometimes I accidentally do them. But so with the bottles, I'm usually looking at what will actually make their mouth do a similar thing to
Mhm.
the breastfeeding. And that includes like that slow flow nipple because so many families think, oh, they're older, so they need this bigger size, right? And one of my favorite like conversations is, well, your nipple doesn't change as they get older, right? Like they just get more efficient. So making them work for it is part of that learning process at the breast.
Yes, and this is a soapbox I've been on so much lately of so much of baby products are marketing. There are 4 or 5 sizes for every bottle because they want you to buy lots and lots of nipples. But I have a lot of babies and even typical babies that like friends and everyone that have babies, if they're good on a level two, they're going to be on level two all the way till they're done or level one. I've had babies on a preemie nipple all the way till they're 1 year old and come off. The reason is because babies become more efficient the better they are at eating. And this is true on the breast or the bottle. So if we keep increasing the flow to try to get them to go faster, we actually just kind of drown them where they now get too much liquid and they actually become purposely less efficient so that they can not have so much liquid at once. And so a lot of times by backing up that nipple size, we can actually see faster, more efficient feeds because they learn how to work the nipple, how it's supposed to be worked. Um, the way that like bottle nipples work is they're designed that we get a really good latch on that nipple and we create suction. And with that suction, we can become really efficient. If we're always breaking off of it, trying to slow it down, or if we're clamping our lips on it to slow that nipple down, we can't get the full stripping motion that we need. And that same stripping motion is used on the breast. And so a lot of parents are like, well, the box says they have to go to this size. You don't, and it really is okay. And it's not a sign of developmental progression to be able to go to a faster flow nipple. It's not, it's a, it's a totally made up system.
Oh yeah. I have the same soapbox because parents want to know about like infant cereal and infant yogurt. And I'm like, yeah, those are marketing gimmicks. Like
Yeah.
there is nothing superior to those other than the fact that they cost more. So you can definitely just feed them the same stuff. Um, yeah, and I think too, the other big thing for me when I talk to families is that if you're hoping to try to get back to the breast or if you're hoping to just keep supplying breast milk, the biggest factor is making sure you maintain your supply. We can't get a baby back to a breast that doesn't really have much milk, right? So we have to make sure we're maintaining that supply. And that's something that we can definitely work on in a pre-program or at the beginning, like as one of your first goals is establishing that supply. And I have had moms that wanted to kind of bring that supply back up so that they could continue that having that as an option even. And that's definitely something that we can support you in and can make sure is available. And then I've also had moms who pumped a ton, never got to use it. And now they're like, now what? What do I do with this? And then we come up with really fun ways to use it, like as the base for
Mhm.
smoothies or other like fun ways to use that breast milk up. So those babies are still getting all that really good nutrition, or those toddlers still getting all that really good nutrition. And it doesn't feel like it just went to waste. So I feel like that's another big part of the conversations we might have with families is making sure that they, yeah, as you said, just really understanding what their goals are. Is it really important to them that the child gets to nursing and that's something they really want to try? Or is it just more important that that breast milk actually gets into them in some way? In which case, we have lots of avenues for that, right? Um, so I think that those are always good, important things for families to understand and to ask questions about and to let us know about at the pre-program, especially because that's something that we would then take into consideration as part of our goal for the family and our strategies for the family. Like I said, like a supplemental nursing system, so they're going to get more the moment that child latches instead of just relying on mom's expression.
Yes. And I think, oh, that's part of a really important part of developing your program for weaning is every family is different and every child's different. And so we want to take into account your family goals and your family's culture, but also balance that out with the baby's needs for the weaning and the how to get all of those pieces together. And that's where we can kind of help you figure this out. And like you said, you have 102 ways to use breast milk if it's not for breastfeeding, which is really cool because that you work so hard to pump. That's a full-time job on its own. So let's use it.
Yeah, and the other thing I was thinking about just now is that I think some parents come to us and talk about how the child will suckle at the breast, but isn't actually actively removing milk. And so I think the other piece to remember is that that is part of the breastfeeding relationship. So there is never, just because your kid has a tube, does not mean you can't let them suckle at the breast. And in fact, if they're willing to suckle at the breast when you're running a tube feeding tolerance is likely to go up because they're actually going to be stimulating that gastric. So digestion starts in the mouth. So we're stimulating digestion because we're suckling, which sends a signal to the stomach saying, hey, get ready, something's coming. And so that actually prepares the stomach for when you start that tube feed. And you're going to have better digestion. You're going to see, and not to mention, the baby and mom are just going to be so much more calm and regulated. And regulation is part of what helps us digest well. And so I think that that's another big piece of that puzzle. We hear families all the time saying that, like, oh, my baby just doesn't tolerate it. I can see them getting all squirmy. They just always seem so uncomfortable with the tube feeds. And a lot of that can have to do with, I mean, there are many reasons, but a lot of that has to do with you're essentially pumping straight into a cold stomach. It's not prepared. It didn't know food was coming. It didn't get those signals of smelling food, seeing food, tasting food to get the signal that something's about to come. So it's playing catch up. And then on top of that, oftentimes our kids are tube fed in these less biological positions, right? They're being held up, they're being propped up, we're doing all these things, as opposed to a nursing relationship where they'd be skin to skin and snuggled against mom and all the oxytocin is flowing. And so even on tube feeds, we can accomplish a lot of those things, that suckling, that closeness, that oxytocin rush, all of those things that help to promote good digestion and get baby into that very comfortable, relaxed state.
Yeah. And it's also for there's so many benefits for baby, but also for mom. to have that it's very relaxing and calming, and you get that same dopamine hit when you're cuddling your baby and having skin to skin. And a lot of times when your baby's tube fed, you miss a lot of those opportunities because it's like, oh, I'm just plugging you in and we go. But having those moments and being able to sit down and rock your baby and be close and have that bonding is still really important. And I have a lot of moms say that that's something they really miss. And when they do start being more oral, that's something they feel that they're like, oh, I didn't realize how much I needed that. And so it's really beneficial for your own health too. And dads can do it too. They're not going to breastfeed, but they can still hold in a feeding position and even doing a pacifier, things like that. They can do skin
Yeah.
dependent to get those same bonding moments and that kind of oxytocin, that dopamine hit.
Yeah, with our daughter, she we were just joking about it with her the other day. But when she reached a point where she and her older brother aligned on an afternoon nap, we actually had a tube feed that needed to run around that same time. And so we ran the tube feed while she napped on us. And so we were joking with her and we said, you were held for 2 hours for a nap every day for the first year of your life. So for the first year, it was either me, my husband, or my mom. Someone was physically holding her the entire time. Um, and it was just that feed often ran really well. She was very relaxed and like we didn't have as many spit ups because she was a chronic vomiter. So that was like a much more likely to be tolerated feed. And we all just sat there smelling this snuggly little baby. And it was like just such a relaxing way to spend an afternoon. Um, yeah. And so like for her, but that was like that was her first year of life was just being snuggled because I didn't get to nurse her. I didn't get to snuggle her in the middle of the night. It was like sitting, propping her up on my legs and trying to feed her and trying to like get her all the things before her tube was placed. And that was just such a like once she had the tube, this amazing ability to just snuggle our baby, which we had not gotten to really do much when we were trying to force feed her prior to the tube.
Yeah. And I feel like when a baby needs a tube, in this group we talk so much about getting the tube out because that's what we're working on, but tubes are a great tool and we're all very big advocates of getting a tube feed when you need it. And I think that's a really big kind of aha moment I have with a lot of families when a tube is placed is that one of those stressors is taken out. Like your job as mom and dad is to love them, feed them, and keep them safe. And when your baby's not eating well, you feel like you're failing as a parent. And that is a huge, like primal, I can't feed my baby, I don't know what to do. And that's a lot of stress. And so being able to just kind of relax in that moment and know that your baby is getting what they need and being able to embrace in that is really important. And then when they're ready, we can get rid of that tube. But when we need that tubes are a really great tool. And I think that there's always the stress of like, oh my gosh, we have to get a tube. But once it's there, you can kind of have a moment to relax and take a breath and know your baby's getting what they need. And you can kind of work on that bonding, work on, you know, all of those emotions that come with having a medically complex baby.
Yeah, I mean, you say that, and I'm so vividly brought back to the like when she had got her tube and we were doing our first official tube feed with it. And they started the tube feed. She's getting breast milk. She's, all the things I've been working so hard and I'm holding her and I just started crying. And my husband, the nurse, are like, are you okay? Is she okay? She's okay. Like she's not in pain, checking on me. And I was just like, this is the first time in her entire life that I am able to give her what is good for her without her hating me for it. And it was such a like amazing moment, right? Because I had been literally force feeding my child, and I was the only one that could get her to take anything for the 6 months of her life.
Uh,
And it was she hated me. She hated, I mean, not me all the time, but me trying to feed her. She
yeah,
fought me. She hated those moments. We fought each other. I would get so frustrated at her, like, just eat. You have to eat. And like, so angry. And then we just sat there peacefully, her getting what she needed. She was like cooing, looking up at me, and then she just peacefully drifted off as she's being fed. And it was the first time in her entire life that I got to just be with her and like hold her and enjoy her. And there was something so amazing about that. We both just got to go, oh, finally, after the first 6 months of fighting each other.
yes. And that's a huge moment. And that's a huge moment for bonding and just all of the things that go into development and social emotional development, everything.
Yeah, and with preemies, I'll throw this out there too, because with preemies, there's actually really interesting research that talks about how obviously their brains are underdeveloped when they're born, all the things, right? And so you're always worried about any of those extra burdens they might bear. And there's some good research that shows skin to skin, especially in that first year, can overcome a lot of the cognitive impairments that we might worry about for preterm children. It actually boosts their brain development. It boosts their cognitive development. And that's independent of whether they're getting breast milk or not. Because of course, we have research that also supports like, oh, breastfeeding is good for IQ and all these things. But the skin to skin itself, just being held, being close, actually improves that brain development. So I think that's also super cool for a lot of these families that have these likely premature children, and you're wondering, what can I do? How can I know I'm supposed to breastfeed them. I know I'm supposed to do this. How can I do these things? You can still do a lot of these really functional, beautiful things that can improve their outcomes, even if you've got the feeding tube, even if you've had feeding struggles. There are all these other pieces that are part of that whole puzzle, not just they have to nurse.
Yeah. And on that same note, there's also some research that, quite a bit of research actually, that suggests that there is trauma, medical trauma with having a tube placed, being preterm, all of those things. And the way that babies and young children overcome trauma is response by caregivers. And so by having those moments and those less stressful moments, it actually teaches their brain to override those cortisol signals and teaches them how to, I get stressed out and I can come back down. And that responsiveness, it rewires the brain to those responses, excuse me, of instead of always staying high in cortisol, it helps them, okay, I'm stressed, now I know how to relax and come down. So it actually teaches them the ability to self-soothe and be able to get out of fight or flight and come back down to I'm comfortable, I'm calm. So having those nice calm moments and that dopamine release when you're together is so, so important. And so the more the
And
merrier, I say.
and not just for a baby, because the research has also shown that on MRI scans, mom's brain also goes out of that fight or flight when she's holding baby. So there's a co-regulation happening that's really, really cool. And they see that babies held in that skin to skin or being snuggled, both parent, caregiver, and baby downregulate their cortisol, downregulate that trauma response. And so it's just a really cool co-regulation that's supposed to be there. And again, when you have a medically complex kid, a lot of those initial moments are kind of stolen from you. You can't hold them for a while. You can't be with them all the time. You can't, you do your best to be there when you can, but they might be on machines. I didn't get to hold my daughter for, gosh, 48 hours or so after she was born. You miss those things. And so I think it can be helpful to know that not all is lost, right? Like there is actually a big window of time to still do that. And even now, as she's 7, almost 8, holding her is one of the most soothing things I can do for her. My 4-year-old just was acting funky today, and I was like, "Hey, what's up? Are you not feeling good? What's going on?" She said, I just, I haven't had any snuggles yet today because I was the only parent here today. So I was like racing around, getting everybody ready, doing all the things. And I was like, well, we can fix that. And so she just latched onto me. And as soon as we had snuggled for a few minutes, you could see her whole energy pick up, her attitude pick up, everything just regulated. And so there's no time limit on when you can start encouraging or enforcing this type of snugglies and closeness and all of those things.
Yes.
Um, so it looks like we're going to be ending pretty soon. I know we've had a few different people popping in and out. I saw up to almost 10 at one point. So if anybody has any questions, please let us know. You can always, the other thing to let people know is that we do provide, like, if you wanted to talk to me just for lactation guidance, like, hey, we're not ready to wean, but my supply or whatever it is, you can always book with us that way as well. You don't have to commit to a full wean. You can work with me just through lactation support. And additionally, even if I'm not the dietitian on your wean, whenever there's a breastfeeding thing going on, I always get pulled in. So you also can have that benefit of lactation support. If you wean with us and you're assigned to one of the other dietitians or another team, I still get alerted if there's any desire to breastfeed. So I'm always in the loop with that team. And then I will kind of like work side by side with the rest of your team. So I just like to let people know that so that they know that they have that lactation support. It comes as a massive surprise to many families. Um, Amanda, you'll enjoy this. We actually had a family who mom weaned with us with their older child a while ago, and then they just had another baby, and all the trauma came back, and mom started
Yeah.
getting really anxious about whether baby was getting enough because he lost quite a bit at birth, all the things. And so she reached out and was like, do I still have time? Can I use my time for him? And I was like, yeah, never expires anytime. So now she and I have been working together. Baby's thriving. He's doing great. There are no concerns.
Perfect.
But it was so cute because they worked with us forever ago and they just came back because all the worries came up. And so I've
Yes.
been providing lactation support for them for their
And
newborn.
that is so normal to have that like
Yes.
rush of like everything comes back and what if and I actually have a family locally that I work with that um first baby had a fairly complex feeding history and second baby came along and mom would be like she would reach out and she'd be like is this normal like she's like I never had a baby eat normally is this normal and we were actually like very normal for a while and then we started having some issues and we were able to catch those right away because she knew what to look for but she for a long time when he wasn't having a hard time was kind of she's like I know I'm being triggered but I need someone to tell me that this is normal and that's so normal when you've had a medically complex baby, especially as your first child, you don't have a gauge of what is normal or what, and typical babies can be up and down. Typically eating babies can be up and down. Um, but if you're not used to that, you're used to any down is awful. It can be very, very stressful. And so having that support is really important. And I'm so glad they were able to get back to you.
Yeah, they were super cute and funny too because mom was like, well, yeah, I mean, he'll like go longer spurts, but then he seems to drink more at the next one. I was like, oh, you mean like he's regulating himself like a typical human? And she just started laughing because I was like, she's like, yeah, he is. I was like, great, that's exactly what we would expect. So it was just
Yeah.
super funny. But I totally get that as a mom to two other children after my tube fed baby. Um, my anxiety was super high with those kids. My anxiety around their feeding, around everything was crazy high because any sign that something might be going off the rails, um, I got anxious, right? I got worried that we were going to go down the wrong path because I had seen what that looked like before. So I think, yeah, just knowing that we have that support and that we really do try to provide that full rounded experience so you have lots of resources available to you and lots of different I mean we have several dietitians and several feeding therapists and all the things but we each have our own niche so I think that like that's helpful too that if we don't gosh I text the other dietitians all the time like hey when you've seen this what do you think like I did this and this can you think of anything else I might be missing and they do the same you know we work as a big team to try and make sure that we're providing the best guidance we can. And as you touched on earlier, that's what makes it unique. That's why we don't just hand out a plan. We want to get to know you. We want to know your
Yeah.
goals. We want to know what's important to you, and we want to try to help you achieve those if we think they're achievable. Um, because it's not just a much like many people ended up, oh, at the hospital, they told us we need to go to bottles because that's how we got discharged we're not going to force you to go to bottles to wean your child. We want to talk with you about what's realistic and what's not. But I think oftentimes, especially with medically complex kids, we don't feel like we have a lot to say, and we don't feel like we kind of feel like we're at the whims of the medical team. And so I think just understanding that that's not how we run. Like our goal is very much to meet your family where it's at and where it's hoping to go, and to support you on that journey, which might look very different from someone else's, as opposed to, well, you're going to have to give up the breastfeeding because that's just not going to work and we can't wean to that, right? So I think
Yeah.
that's an important kind of just point to remember and keep in mind. And that's why you have to do a pre-program and we want to know so much about you. And we like, that's why.
Yeah. And I always encourage families that when we tell you to do something, if you're not sure about it, ask us why you want, and if we haven't explained, ask us why. We should always have a reason. And I mean this for anyone on your medical team. If they're telling like you have to do this, ask them why, especially if you're not sure about it, because you then one they should be able to tell you there should be a reasoning for it, and they should have a reason. And if you're like, hey, this doesn't align with my goals, being able to say that and say like, okay, this is my goal is. We can say, okay, we wanted to do it because of this. Can we meet you here? Or this is why we feel that like that might not work so well. And so having that communication is really important. But if we're telling you like you should do this, there's a reason. And so ask us what that reason is if you're not sure, if you're not understanding, because we want you, you're a part of this process. And so we want to make sure that we're helping you be able to advocate for what's best for your child.
Yeah. Yeah, I think that's great. Yeah, exactly that. Just,
Yeah.
and we talk a lot about that because it's just such an important piece of what we're doing is trying to really, even though we're medical professionals, we're trying to unmedicalize the way you're feeding your child. And so we're giving you that support as educated, certified professionals. But I think the main goal is to empower you as parents again and as caregivers again to feel like you are in control of that feeding environment. And that can be a really hard shift when you are used to not being allowed to adjust your tube feeds until you've met with your GI again and not be, like just feeling like well, do I need permission to do this? Do I need permission to do this? And so part of what we're doing is trying to empower you so that you don't feel like you need permission to feed your child.
Yeah. And I think we've had a lot of families where I've seen the reminder, I guess, is that you're the parent, you get to make the decisions. We can advise you, but we can't tell you what to do, kind of thing. Like we can give you our advice on what we think you should do, and based on this, and this is why. But at the end of the day, with any of your providers, you get to make the decision of if you do it or not.
Yeah, so thank you all for coming. Again, we will come back and check if you comment later. I have to
Mhm.
run because apparently a child has injured herself.
Oh
So
no.
it doesn't seem that bad. They're all giggling to each other, so
Okay.
I think we're mostly okay.
Yeah.
But I'm gonna go see what that is.
Yes. Good call. Everyone have a good night, good day. I guess it's not nighttime.
Bye.
Bye.